But I'm just telling you, they ask you pre-op. All right, let's go. They're going to ask you some pre-op questions, right, and post-op. Remember, anytime you're teaching a client on anything for the surgery, you always do it a week in advance. And one of the first questions the patient gonna ask, am I gonna be able to have kids? If they catch it early, yes. If they don't catch it early, no. So you wanna talk to them about options, about what? Adopted, right? Which black people don't like to do, but yeah. You wanna talk to them, right? Donating sperm, yeah. Okay, that's what I'm talking about pre-op, those questions. You got it? Right. Post-op, after the surgery, priority is vitals. Now, if in the question they said the patient had surgery, testicular surgery, what did the patient do? You will intervene. Lift. This patient cannot go lift. Now, are they going to give it to you so easy? No. Let me tell you what they're going to say. Now, you remember, it's boys. Which one he do need teaching? You will intervene. I'm a young man, so when I go riding a moped or motorcycle or bicycle, what am I doing? Pedaling. That is a form of lifting. NCLEX not going to give you lifting like lifting a box. If I vacuum, that's a form of lifting. So those are the questions they get you guys on. Because you thinking, oh, lift a box. Them people not going to give it to you so easy. They cannot lift. Okay? And if they do lift, you got to watch how many pounds. Okay? So let's go. The physician is to be called if the patient have chills, fever, increasing pain. Where did I teach you that? Okay. Where did I teach you if the patient have fever, chills after surgery to call the doctor? Fundamental pre-op, post-op, because that is called what? Pneumonia. Come on, people. Why would you say that is called medical emergency? Pre-op, post-op, I taught you that last week. Right? So you will call the doctor. Instruct the client that he may resume normal activities within what? A week. Except what? Lifting. Okay? Or climbing. Instruct the client to perform monthly TSE where? There you go. Inform the client that the sutures will be what? Okay. Nurses, one of your skills from your skill sheet is to know how to remove sutures, how to remove staples. RN, you must know how to remove the staples. You must know how to remove the suture, and that is in your skill book. You gonna look. You're gonna go in the index and put remove suture. It's there. I can't find the pages for you too. I'm gonna charge more money. Right? Remove sutures. Right? Make sure you know that. Remove sutures. Self-breast exam. Testicular, right? Here's your sheet. You need to get your skill sheets. You need to do the skills. You cannot go to NCLEX, don't know skills. Right? Here's the skill book. Right? You need to know skills. And if it's not in here and I give it to you, Google it. And look and see, put it in order. That's it. You cannot go to the people test. You will be very sad if you open piercing door without knowing skills. Show, baby. Show. You need to know skills. All right? Any question? Okay? Testicular cancer. Right? So check. Testicular. Now, check cervical. We're next. Cervical cancer is you get this cancer, not genetics. This cancer, you get it through sex. STDs, yes. No. Okay, box 4211 on page 506, NCLEX sometime will ask you, they will not say testicular cancer, but they'll give you the name, germinal tumors or non-malignant tumors. Just while you're reading, just read the type, because sometimes they can give you the name. But it is understood that it's testicular cancer. Cervical, yes?
Sorry, ma'am. About the testicular cancer after surgery. So what kind of activity do
They can do swimming. They cannot climb. Things that has to do with pushing, pulling, climbing, they cannot do. Pony riding, they cannot do that. All right? Yes.
Last week I remember you said that about the alpha protein test is elevated for prostate.
Yes. Let me explain to that. It says if it's elevated. Okay. Let me explain to you. A lot of people think because it is testicular, you automatically have prostate. It's not true. What I want you to have in common, to know that it is all related to men, and what the doctor will do, because it's testicular, they will also do alpha-fetoprotein just to see if prostate. But before they go there, because I'm 14, they will ask you history of that. It's cool, all right? Yeah. Okay, all right, let's continue. What I want to say, listen, because testicular is men, prostate is men, of course, if the kid have testicular, they're going to check prostate too. But I don't want y'all to think, everybody who have testicular got prostate. Yes, they're going to check all labs. But I want y'all to know I don't want you to have it written in stones that everybody have testicular, they also have prostate, because testicular normally find in young people, 14, when prostate come in. But they might go in your history of that, and that's where the alpha-fetoprotein come in. Yes? Yes, prostate cancer. Prostatitis, BPH, inflammation, yes, it can go into prostate cancer.
5.5.
No, well, it depends. You got to look at the whole, everything. Biopsy. You got to look at AFPs. You got to look tooth factor. Yeah, prostate problem. That's how the people die, especially black men. Yes.
I've never heard from that from my country, right?
Huh?
Yesterday I heard something on the news. Like 80% of Haitian women have prostate surgery.
Yes.
I've never heard from that.
Yes, 80%. Let me tell you why. It's not 80, well, it's out, because this is Breast Cancer Awareness Month. 80% of Haitian women diagnosed late with breast cancer. That is why it's out there. Because there's some, you know how the year turned, new year, and we drink soup, but we gotta go get our breast check, we gotta go get an AIDS test, we gotta go get a teeth check, and we don't. So eventually we die from it quicker. See, white people, white women, every year they go do a checkup. We, black people too, not only Haitian, black in general, don't never, and they got Medicaid, don't go and get stuff checked. And that's why we die from it quicker. Because when we find out, it's in the last stage. So now they put a whole lot of cameras on it, right? You 35, you 40, you old, go get stuff checked. Yes, I heard about it. It is true. And our insurance card is in our wallet. And we work a whole lot of damn hours, but we don't use it. So we find stuff last. It's true. We work a whole lot of hours, but, okay? So, cervical cancer. What gives cervical cancer? HPV. Akamalata, right? Make sure you know that. Kandalamata. HPV give you cervical cancer. Untreatment of STDs, chlamydia, gonorrhea, syphilis give you cervical cancer, right? Of course, cigarette smoking, obesity give you everything. You guys know that. However, sex, having sex early. Now here it is. Boys don't get cervical cancer. Boys get rectum cancer. That's why boys can get Gardasil, girls can get Gardasil. Gardasil is a vaccination that you get to prevent cervical cancer, right? So if you have HPV, which is the wart on the vagina, right? The wart, it doesn't, or guys have it on the penis, on the rectum, you have to get it taken care of right away. And remember, STDs, right? What do we put on the HPV to melt the wart? Trichloric acid to fund the wart, and they will give you Gardasil. Gardasil is a vaccination that comes in 3 doses. 3 doses. Gardasil, right? You give it today. 2 to 4 months, you come and give it again. And 6 months, you give it. Now, if you're not sexually active, we can give it to you 9 to 26 years old. Middle school, give you a paper to vaccinate your children with the Gardasil. Boys can get Gardasil, girls can get Gardasil. That's the biggest thing the Haitian president known for. That sweet Mickey guy, boy, he give Gardasil in Haiti like I don't know what in the schools. It was a big article on it. To prevent cervical cancer. All right? Now, when you have cervical cancer, right? Ready? You have painless vaginal bleeding. You have poo-poo come from your vaginal. Right? Hey, this is when the family member has AIDS and they don't want AIDS to go on your death certificate. They put cervical cancer. Anytime you have cervical cancer, AIDS gonorrhea, chlamydia, no good. Now, when you have cervical cancer, you have some options. You have some options. Ready? They will do some treatment. Treatment. Don't go with cure. Treatment and cure, not the same. You have some option. The first option they will do is they will do chemo. Right? And because it's a cancer. And guess what chemo they're going to give you? IV. And another thing they're going to give you, if they catch it early, a seal radiation. Seal. You remember brachytherapy, come unseal and seal? This one. That's the one they give you, they put inside. They will do radiation. That's the first. The second option, they're going to do hysterectomy. Ya petit tout, right? Hysterectomy, right? Hysterectomy. Another name for hysterectomy is salpingo. Next to hysterectomy, you're going to do this. Salpingo. Étirer tout. Remove everything. Next to hysterectomy. Now, I'm on page 507. And I want us to focus on F and G. Because we did hysterectomy. H. Now, the patient have other options. We either do chemo, hysterectomy. We also do something called cryo surgery. Cryo surgery is where we freeze. They use ice. And they freeze a certain part of the cervix. Right? What's priority after that? You will always see a discharge after cryosurgery. Please don't call the doctor. It is expected. Okay? Instruct the client to avoid intercourse and use of tampons. Now remember, anytime you have cervical cancer, it is reportable. No HIPAA. You know why? Because you got it from where? HPV. HPV give you cervical cancer. So you must report it to who? Health department. You already on Front Street. When you have stuff like that, you got STD, chlamydia, gonorrhea, no HIPAA. Because it's a community issue. And it's a felony. You can't go to prison. No HIPAA. Right? Now, the other one is called colonization. That's an NCLEX question. A colonization is people who still want to have kids. How you going to have kids and you're not good? You don't supposed to sleep with nobody with no protection. So, but if you find Mr. Right that say, hey, baby, you died, me and you going to die together, that still want to have babies with you, you can say they will cut a certain part so you're still able to have children. I don't know who's going to sleep with you, but yeah, you can do it. That's an NCLEX question. Okay? It's performed for people who still want to have kids. But you at risk for incompetent cervix. Cleon, cannot keep. So you can lose the baby. Well, you at risk for miscarriage. But we gonna do it. What you wanna do, the doctor gonna do. But you at risk for premature labor and all the other stuff that comes with it. Alright? You got that? So far, when you have cervical cancer, Miss Sonia said that's treatment. Then Miss Sonia says a cure, treatment. I told you hysterectomy. Another name for hysterectomy, they say bilateral o salpingo. Remove everything, right? Or sometimes they say unilateral, like an ovary. You know, they'll leave one. You messed up down there, like whatever, right? Colonization is when the lady want to have kids. Cryo surgery is freezing. Make sure you know that. Now, here it is. When you are in stage 4, we do something called pelvic externation. That means nous fait devant, semblé derrière. We make your rear look like your front. They remove the vagina. It ain't no good, so they remove it. That is called pelvic externation. Now, box 4214, I want you to put NCLEX, right? Pelvic externation. They got exterior and posterior. NCLEX asks you, give me all that apply in anterior. Watch. We remove uterus, ovaries, fallopian tube, vagina, bladder, urethra, and pelvic lymph nodes. So, they take everything out. Your front, your back and front look like a bunch. Nothing. Posterior, they remove the uterus, the ovaries, fallopian tube, descending colon, rectum, but you're left with your vagina. Or if it's bad, they remove everything. Now, when they do that, they also bring a psychiatrist because you may commit suicide. No more life. No life. Guys, sometimes you see this, like when you a nurse, ER nurse, well, a nurse, and you work for a big hospital, certain things you see, if you're from the island, you're like, oh my God, I've never seen syphilis so bad in my life until I went to work at Broward General. The girl had syphilis for all year. It even got in her brain. And she kept yelling for no reason. I'm like, damn, can you shut the hell up? And in her, you go in the room, you should see a beautiful picture from high school. Black girl. And then you see who's on the bed. The syphilis eat all her brain cells. Every 5 minutes she yelling, ah! Ah! And everybody come in, the Haitians talking, the Jamaicans talking, because this could have been prevented, right? And so when you have a disease, you got it because you was out there, people don't show, right, a lot of sympathy, you know? But yeah, you like, oh my God, I didn't even know that. I mean, the syphilis took over, right? It took over here, all in the brain. I mean, it was just terrible. I didn't know those things exist. I said, oh my God, I've never seen such thing. But it's out there. STDs, very, very, very big. I don't like to judge nobody. I'm telling you, I'm not an old nurse, but African Americans, this here is what's killing Black American. In Broward General, this is what you see. STDs flying right enough. You see some little Haitian, the young ones, who try to be American now. But yeah, it's very big in the Black culture. I don't know why, but it's out there. Any question? Make sure you know that. Anterior, they NCLEX ask you, give me all that apply. Posterior, all that apply. And then they ask you both. Okay? Pelvic externation. Go with cervical cancer. Yes.
The syphilis
Yes, when we do OB next week, you'll see. Oh, yes, syphilis is reportable. Yes, herpes is not reportable because herpes come and go, right? Syphilis is reportable. HPV, reportable. Gonorrhea, chlamydia, reportable. Hold on, let me say one thing. So, another thing they ask you, pap smear. Big on NCLEX. What age you get pap smear? Here it is. You get it when you are sexually active. If you're sexually active at 14, pap smear. Now, if you're not sexually active, 21. Doing a pap smear does not make you not a virgin. If you think after a pap smear it makes you not a virgin, you wasn't a virgin going in. Pap smear does not make you not a virgin. That's an NCLEX question. And once you have HPV, you got to do pap smear twice a year now. Pap smear is once a year. But if your pap smear came out abnormal, then you do it twice. Yes, yes. No, okay. They can get a cerclage, but they still can lose the baby. Okay? Any question? Yeah, hold on. Let me go to him and I'll come to you. Yes.
You said the Gardasil is given between 9 and 26?
If you're not sexually, if you're not sexually active,
Okay.
never had sex, right? We can give you Gardasil from 9 years old. Boys and girls get Gardasil. Boys get it too, because boys don't have a cervix. They have rectal cancer. Rectal.
But if you are sexually active, can you still
You
get Gardasil?
still get it if you have HPV, and we don't want you to go to cervical cancer. See, you can give Gardasil as a preventive measure, and if you have HPV, I don't want HPV to go to cervical cancer, I give you Gardasil.
Okay.
Yes.
So if you sexually active, you can get pap smear
No, if you sexually active, 14, my boy example, you need to get pap smear. If you're not sexually active, then 21. Yes.
Because this year, if you take only one,
No good, you gotta start over. It's 3 doses. Now, adverse effect of Gardasil, they call it drop attack. You stay just like that, you hit the floor, float, and it make you ever had the flu shot? That fever, that body ache, that is the adverse effect of Gardasil. Yeah, it don't feel good, that's why they don't like it.
So that's why when they get it, they have to just stay there for 15 minutes?
Yes, yeah, because it's a drop attack. You hit it because I don't be flu. For some reason, they give them drop attack. That's adverse effect. That's why after you give it to them, they gotta stay with the nurse. Yeah. Any question? We cool? Okay. Then we go to ovarian cancer. We move here right along. Ovarian cancer. Cancer of the ovaries. Ovarian cancer, you don't get that from sex. This is what's killing us too, Haitian people. We don't know how. Black women, we get it. You die tomorrow. Why? Because the way it comes is like acid. Oh, I have GERD. So you go to Walgreens, you get Tums. And tomorrow you in hospice. And you have a mass on the stomach. Very hereditary. If cousin have it, it's not like breast. Breast, for you to get it, when they say genetics, you got to make sure you understand what they talk about when they say genetics. Breast, my grandma had it, my mom at risk, my mom's daughter's at risk. our daughter at risk? Breast. Ovarian cancer, third cousin of the cousin, we all at risk. Pancreatic cancer, cousin of the cousin of some more cousin, we all at risk. You got it? But breast, more close. Okay? Very big when they say genetics. Now, ovarian cancer, there's a tumor that is a marker. A marker is a CA-125. When the CA-125 elevate, that's why they want you to do the BRCA. The BRCA doesn't say, hey, Kawal have breast cancer and ovarian cancer. And breast and ovarian cancer, husband and wife and cousin. You can have it. You can, if you have breast, most likely you will have ovarian. That's why when your BRCA is high, like Angelina Jolie, her mom died at 50, so her BRCA came up like 90-something%. She didn't even have it, but she knows she's at risk. She removed both breasts and she did a hysterectomy. And that's the way you do it. You don't only take off the breast, because you remember I told you breast cancer and ovarian cancer, husband and wife, they link. So you remove everything, right? So they will do a CA-125, a marker. And that marker also will tell what is your chances of getting ovarian cancer. Ovarian cancer, the reason people die from it so quick, because it doesn't look like cancer. It looked like other things. Oh, I'm tired. I worked last night. I have acid. Maybe I gained a little weight. So you put it off. Because they will move you in the hospice. Very rough disease. Patients die like that. Yes. No, when you're pregnant, you have nausea and vomiting. That's from pregnancy. But there's something about ovarian cancer. It normally hit you at 50, 40, over, where you wouldn't have to be pregnant. No, sick up. But remember now, 45 is like 50. So anytime you 45, you really pushing 50. You need to start doing these tests. Okay? Any question? So look at the ovarian cancer sign and symptom. Stomach swelling, go to Walgreens. GI problem, indigestion, dyspepsia, gas. Now, dysfunctional vaginal bleeding. Special black women. We have dysfunctional vaginal bleeding. Our periods all messed up. But when you see you keep bleeding non-stop, that's what makes you go to the doctor. The big stomach and that bleeding. And it's too late. Okay? And then, you know, a lot of women say, well, if I do a hysterectomy, I don't feel like a woman. If you're 50, let's say you're 49, 50, you have your kids, they grown. Why not go get everything removed? Like, what? Why would you think, I just don't know how people think, oh, I'm not a woman if I remove it. Hell, you're 50 years old. Your time of having kids over. It doesn't affect for you to do. I think a lot of women think, well, if I remove it, I won't be able to perform. When you're 40, hell, you don't. I mean, yes, you do perform, but you're tired. Y'all should be studying. Oh, y'all said, oh, don't speak for me. Right? I mean, you tired anyway, but that will not stop you from not performing. What? Right? Okay, on page 508, they go to salpingo hysterectomy. That word, number 5. You see it? So anytime you see that on NCLEX, they're talking about hysterectomy. Florida give you a lot of English. Florida bon anglais baby. Sou pa comprendre. Wap e pran nan gwo roulo. Understand the different languages, okay? O salpingo, they can say unilateral, bilateral, it's still a form of what? Hysterectomy. Okay? Any question? All right. Now, endometrial cancer. Now, let me explain something to you with cancer. NCLEX get you guys on the all that applies with cancer. I need you guys to make sure y'all know the risk factors. Who's at the risk? What's the risk factor in breast cancer? Key risk factor in ovarian cancer? What risk factor in cervical cancer? The problem with students, they'll say, I read cervical cancer. No. I want you to really go read it. Because the risk factors in cervical cancer is not the risk factor in breast cancer. Breast cancer, if you don't have no children, you can get it. If you got too many children, you can get it. You understand? Cervical cancer only happen through sex. A lot of students mix that up. Cervical cancer has nothing to do with menopause. Nothing to do with menopause. Okay? So the problem is, I need y'all to know the risk factors. Alright? Alright, so we'll take a break. Okay, I'll see you at 11:30 back. The new students, you can